Hello and welcome to the Valley. Today I am your host, Janet Michael. It is Community Health Day. That is the day every month that we jump on a Zoom with someone from Valley Health to talk about a health topic of some sort. Over the years, we've talked to cardiologists, neurologists, we've talked about mental health, we've talked to administrators. I have met several robots within the Valley Health system because of this show. And today, our topic is men's health. June is Men's Health Month. So Dr. Isaac Prince is joining us. He is with Valley Health Primary Care located on Jubal Early in Winchester. Dr. Prince, thank you for taking some time today to give me an overview of all the things that men need to know in order to take proper care of themselves.
Of course. Thank you for having me on.
So is there like one big thing? Is there multiple big things that you wish that men would know about taking better care of themselves?
Health's always a culmination of things. And of course, there's a lot of things feeding into it. I think one of the more overlooked things with men's health is the aspect of mental health for men too. I think a lot of it gets masked over time and covered up, and people don't put as much thought into it because men are stigmatized as tough people that can get through a lot of situations. And what that winds up with is a lot of bottled up emotions, depressions, anxieties that aren't approached as tactfully as in women. And then that kind of stems into other things because untreated mental health leads to obesity, it leads to metabolic syndrome and elevated blood pressure and cholesterol, and then heart attacks and strokes. So I think kind of gets fed in from a lot of different directions because everybody knows the basics of eat healthy and exercise, it's good for your health. But sometimes these things don't get touched on the underlying reason of why somebody's not taking care of themselves, why somebody's not exercising, why somebody's not eating healthy, why are we smoking a pack of cigarettes a day? It's probably because we're stressed out and we're not taking the time to address those things underneath it.
I have a lot of conversations with different mental health professionals at Valley Health. We always talk about how we feel like in the last several years, the topic of mental health has become a lot more mainstream. People are more willing and open to talk about any struggles that they may have. But I think you're right in that a lot of that is focused on women and not necessarily men. And they struggle with grief and they struggle with anger and they struggle with a lot of the same issues that women do, but we don't tend to target them when we're talking about those topics.
And I think a large portion of it is taking the time as a healthcare provider to target those things too. But it's also that tends to be that guys will not bring things up when they're bothering them, especially first time you see somebody, it tends to not come up much, but then it'll start stemming as you see them back more and more. So the importance of really having that good backbone and that good healthcare provider that you trust and you have faith in that they're going to do what's right for you. Because a lot of the times, especially if you're seeing the doctor every 10 years and there's only so much time to cover everything. So sometimes it gets brushed under the rug and turned into, well, your cholesterol is high, eat healthy. And then that was what the last doctor told you. And now you haven't seen another doctor in 5 years, bridging that gap and finding the time for it too.
That's a good point that you make is the value and benefit of having that primary care physician that you see on a regular basis. I would imagine, and I am trying not to get in trouble with my husband here when I say most of the time guys don't go to the doctor unless they think something's wrong. And there is value in having A, that relationship, but B, that ongoing checkup to make sure that you're catching something maybe before it gets to a stage where it would be an emergency of some sort.
That's why women live longer than men, because women do tend to go to the doctor. They have a regular relationship with a doctor. Part of that is they also have an OBGYN. They know the importance of that. But what it turns into is women are much more likely to have a primary care doctor too. Guys are much more likely to not take time for their own health. So it's super important just to have that regular checkup just to make sure everything is all right, because you can feel fine, but your body can be starting to run amok on you a little bit.
And there are several just common health issues that men tend to face on a regular basis. Can you tell me what some of those are?
So the biggest ones are really diabetes, prediabetes, or blood sugar getting high. You can be completely asymptomatic and feel completely fine, but your blood sugar is kind of tumbling out of control on you. Big thing with that is once things get high enough, your body has a hard time of adjusting back to a normal range. So if we can catch things early enough, blood sugar slightly high, instead of being completely diabetic, we can usually get a better grasp of it. So diabetes or blood sugar is one important one. Cholesterol stems from a similar process of the body's metabolism slows down as you age. As we gain weight, cholesterol builds up, sugar builds up. The cholesterol starts to deposit in the arteries, which leads to heart disease, heart attacks, strokes, and then blood pressure too. We call it the silent killer for a reason, because you never know your blood pressure's high. Your blood pressure can be sky high and you don't even know it. A lot of these times when people haven't seen a doctor in a long time, they're usually slated for something going forward. It's hard to make it to 50, 60 years old and have no health issues, which is what a lot of guys are stressed about, is they don't want to come in and be told that something has started to happen. But the earlier we can recognize these things and the faster we can get you on the right path, the easier it is. But probably the biggest ones are diabetes, high cholesterol, and high blood pressure are the most common things that we'll see.
That ties into when you were talking a second ago about mental health. Men tend to also think it's a one off thing, or, oh, I'm just having a rough day, or I ate too big of a lunch. They're much more ready to push something aside instead of going and getting it checked out, which then lends itself to becoming a bigger problem down the road.
I don't have exact numbers on it, but if I had to guess, men probably come, especially in the younger ages, men probably go to the doctor half as much as women. And really, the sooner we can intervene on things, we call it preventative care, we can get things set up so you never really develop those things. We can talk about your blood pressure when it's 2 points high instead of 50. And we can talk about your blood sugar when it's borderline high and not even actually high, and we're just aware of it and we can work on it. Really hammering home the importance of getting in there once a year, get your checkup, because it's super important.
One of the other misconceptions, too, I feel like, is when you say diet and exercise are great preventative measures. That means different things to different people. But if you're looking at someone who does only have a little bit of an elevated blood pressure, that diet and exercise is going to look completely different than it does for someone who now has this massive increase in high blood pressure, any of those things. And diet and exercise doesn't necessarily mean now you have to eat salads and give up your steaks, or you have to run 3 miles a day. It's not as strenuous as I think sometimes we assume that it is.
Yeah, it really turns into, when we're saying exercise, what we're meaning is just moderate intensity, as in you get your heart rate up and you get breathing slightly faster than normal, 20 minutes or so a day. It doesn't really matter if you do it all at once or you do it split up each day, but looking at about 2 hours a week or so total for exercise. That can be hiking, that can be swimming, that can be playing a sport, that can be golfing without a golf cart and walking in between holes. It's more exercise than people realize, and that's really for the heart protection more than anything. I think it's a lot less than people realize it is, because exercise doesn't mean you need to go for a 5 mile run every day, which is the conclusion a lot of people get to, is that means I have to go for a run. And a lot of people don't like running, especially as you get older, because your knees hurt and your ankles hurt and it's hard. And typically, especially if you haven't ran in a long time, when you run, you're far past moderate intensity and you're at high intensity exercise, which is good for you, but that's not the exercise we're talking about that's so cardioprotective like the moderate intensity is, just because it's not sustainable. You can't do high intensity for 20 minutes. You're just going to wear yourself out, and you're going to wear your muscles out, and then you're going to be tired. And you're not going to do it again.
Right.
But with exercise, especially if we catch things early with blood pressure, adding a regular exercise routine lowers your blood pressure 5 to 10 points or so. Cutting back on salt and cutting back on red meats and high cholesterol foods cuts it down another 5 to 10 points or so. So those two things together can take you from being high blood pressure, needing a blood pressure pill, to completely normal, as long as we catch it early. And it's similar with blood sugar and blood pressure and cholesterol. Is once we get to a high enough level, it's very hard to reach the amount of exercise and diet needed to reel that in when it gets so high. It's certainly possible, but it's a real slog compared to your blood pressure is slightly high and your blood pressure is 170, because at a certain point, we just got to protect the heart and protect the brain, make sure we're not having heart attacks and strokes, and then people wind up on medicines. There's nobody wants to be on one if they don't have to be. And that's the whole goal of primary care, is I want to have as many people that are completely healthy and see me once a year as possible. I don't want all the people coming in that have 75 things going on. More than happy to take care of them, but the goal behind it is to prevent those things from even happening.
One of the benefits of having that relationship with you as a primary care physician is that you also get to know the patient. And I'll use my husband again as an example. He comes in and he's just getting a yearly checkup, which to his credit, he does do mostly because he has to have a DOT physical. So he's forced to do it whether he wants to or not. But you know him and you can say, hey, this is a little high. You know that we have dogs. You can say, hey, why don't you start taking the dogs for a walk 3 times a week and try and walk at least this far? And maybe instead of having steak 4 nights a week for dinner, you just do it 2 nights. You're able to talk about cutting back, not cutting out, in a way that he understands because he trusts you from that relationship.
Yeah. And that's another whole benefit of primary care is typically and ideally the whole family seeing the same person. So you know what the husband and what the wife are suffering from at that time. If one person has high cholesterol and the other one's depressed, it turns into you both get out and exercise together and walk together and you improve both of those things. So being able to tie back in of, hey, I know your wife needs to work on this, or hey, I know your husband needs to work on this, can be really beneficial to just patient relationships, because without the trust, nobody's going to want to do anything, which is reasonable.
Yeah, I'm sure there are a lot of guys that walk out of there and go, oh, what does he know? It's
Yeah.
not like he has a medical degree or has
Yeah.
been through all these years of schooling.
Yeah. But that's super common. I mean, you can't build complete trust in 20 minutes of meeting with somebody. It's just not possible. You can have a little bit of it with certain people that really trust the healthcare system, but especially the guys that aren't wanting to come in to see the doctor, building that trust in 20 minutes is pretty hard unless you have an in. So unless you know the wife or your friend or something like that, which does build up over time, thankfully. You slowly start building your ins.
Let's take a break. When we come back, let's talk about that a little bit more because I'm sure there are a ton of wives that are listening right now that wish their husbands would see a doctor more frequently. Maybe you can give them some ins on how they can start that convincing procedure. Can we talk about that in the next segment?
Sounds good.
Okay, we're going to do all that when we come back. We are on the Zooms today for Community Health Day. It is sponsored by Valley Health. We are talking with Dr. Isaac Prince. He is a primary care physician at Valley Health Primary Care, located on Jubal Early Drive in Winchester. We're going to come back and talk more about men's health in just a couple of minutes. Hello, nonprofits. Have a project that's been sitting on the back burner? United Way NSV's Day of Caring returns on September 19th, and your nonprofit can be a part of it. This is the region's largest single-day volunteer event with over 900 volunteers ready to help. Whether it's painting, landscaping, organizing, or repairs, Day of Caring gives your organization hands-on support and saves thousands in maintenance costs. It's simple. Submit your project, let United Way match you with a team, focus more of your budget on what matters most, your mission. Learn more at unitedwaynsv.org/Day of Caring or reach out to dayofcaring@unitedwaynsv.org. Let us send helping hands your way. Welcome back to the Valley today. I am your host, Janet Michael. We are on the Zooms today with Dr. Isaac Prince. He is a primary care physician at Valley Health Primary Care. Valley Health sponsors our community health conversation every month. Dr. Prince, when we went to break, we were talking a little bit about, we've been talking about men's health, but we were talking a little bit about how we wives can help our husbands, nudge them along maybe a little bit in getting in to see a primary care physician. Are there signs and symptoms of some common ailments that we should be paying attention to now before they become a big issue?
Yeah, the hard part always is that once things have developed that you have symptoms, it usually means something is going on. So the sooner you get checked up, the better. But if you're already feeling the fatigue or tired all the time, there could have been something underlying for a while. With diabetes, we look out for thirsty all the time, peeing all the time, because that's just the sugar working through your body. Cholesterol and blood pressure, unfortunately, pretty silent. So unless they're astronomically high, there's no symptoms involved in them at all, especially cholesterol. Other than gaining weight, there's nothing that really shows us that you could have high cholesterol other than your lab work and your family history. Family history is super important. So if there's heart attacks in the family, getting in to get checked so we can get the cholesterol under control if we need to, or the blood pressure under control if we need to, so we can avoid those early heart attacks or strokes that can derail people's lives. Cancer things, if there's family history, prostate cancer, colon cancer, it's super important to get in and get checked. And we routinely check people for prostate cancer. It's more of a we talk about it thing now as opposed to you have to get it, but there's a prostate cancer blood test called the PSA that we check at 50. And there's also the prostate exam that nobody really likes to have done, but it doesn't have to be done, but especially with a family history, it's a good thing to check. And then colon cancer screening, we start at 45, which can either be a colonoscopy where the gastroenterologist up at the hospital go with a scope to look for any polyps or anything like that, or a newer test called a Cologuard, which looks for DNA evidence of colon cancer. The colonoscopy is probably the best bet to get done at least once, but there are other options that sometimes people being aware of can encourage the screening of those things. Feeling fatigued is the most common thing that can be a sign of chronic disease, diabetes or sleep apnea. If people are snoring super loud at night or they stop breathing at night, getting to come in and be checked, because I see somebody with undiagnosed sleep apnea that they've had for 10, 15 years, just about every day of the week. And it's usually my wife says I snore too loud and I probably have sleep apnea is what it turns, or my husband says I snore too loud. Anytime anybody's really said that, they're probably right. I haven't really had too many misses on my wife said I probably have sleep apnea. It's pretty accurate. One of the ones that you should really listen to the wife for, because they're hearing you at night. They know if you stop breathing. And then if it's untreated, that leads to heart issues and high cholesterol and diabetes and all those things too. So the hardest part is a lot of the times there are no symptoms. So just encouraging that once a year checkup, because the best time to catch things are before they become an issue. And if they've already led to symptoms, if somebody's already having abnormal stools or blood in their poop or anything like that, that's a sign that cancer's already developed and it's not even a polyp, and they need to get checked out right away. Prostate cancer is pretty silent, doesn't tend to have any symptoms or anything like that. So a lot of these things just need to have that annual physical.
And you have openings right now at Valley Health Primary Care. We were talking during the break about how there's this misconception out there that you can't get in anywhere with a primary care physician. And that's not necessarily true within Valley Health. It may take a few weeks or maybe a few months, but that just gives us wives more time to convince our husbands that they need to go. But you are taking new patients right now, as are several other of the primary care offices in our area.
Yeah. So our clinic here at Jubal Early, I think there's 3 doctors that are taking new patients. We're looking at about 3 or 4 month wait to get in. So the sooner you get the appointment set up, the better. Down in Strasburg, I think there's a couple doctors taking patients. And then the new clinic on Costello over by Costco, I think there's a new doctor that's taking new patients there too. And I know Valley Health's planning on expanding to other places. So hopefully a primary care doctor fills up in a year or two. So hopefully there's that continuous stream of there's a new person in town that's still taking patients.
I mentioned earlier that my husband has his DOT physical every year. There are a lot of employers in our area that offer wellness plans, that offer things that allow people to get those health checks done on a regular basis, or will point out something that maybe they need to come and see a primary care physician for. Those are things that I would imagine you'd recommend anybody participating in.
Utilize all resources that you have, to be honest, especially a lot of those things in people's insurance plans, or they work at the firehouse, or they're a police officer. All these things, they're getting physicals regularly anyways, and they're getting lab work regularly. Take advantage of all free resources that you have. Lab work's not going to hurt you. If they offer all these things, you certainly should take advantage of them. And sometimes they have a doctor there that works with you, and that's great. You can certainly have that and a primary care doctor together. Sometimes it's a nurse that does the checkups, and that's great too. And they just get you in to see somebody if something is going awry. But taking advantage of all resources that your job gives for you. Essentially, you're paying for it. You might as well use it because it's coming out of your paycheck in some way. So you might as well take advantage of it.
And you talk to all of those people. So it's not like, oh, yeah, I'm doing this through work, but they're not going to give that information to my primary care physician. You have access. You can request those records. It's not a lot that the patient has to do on their end either.
Typically, there's something on there that's like, send a copy of this to my primary care, and they just fax us a copy of it. Or they usually print you out a stack of stuff and you just bring it in with you when you see me.
Any advice before we wrap up for either wives or for men on something they should think about doing today to improve their health?
I'd say get outside, get exercise, and get fresh air. Stay motivated. Try to do the things that everybody knows you need to do. You need to eat your fruits and vegetables, and you need to exercise. Quit smoking and drinking. Stay healthy, and try to get that annual physical in once a year.
Thank you, Dr. Prince, for taking the time today. I do appreciate it. I know you're off to see a patient right now.
Yeah, I gotta go.
I will be back tomorrow with a brand new episode of The Valley Today, a few minutes after noon, so meet me here then.